So we were interested in exploring the impact and injury caused by critical illness with the recent pandemic H1N1 infection, and how critical illness impacts specifically the kidneys. And we sought out to investigate in 50 patients admitted to critical ICU unit in Manitoba, Canada, with H1N1. What was their rates of rifle criteria proven AKI, or acute kidney injury, acute kidney failure, and need for dialysis. So this was a prospective cohort study that was done in 7 ICUs in Manitoba, Canada, from April 2009 to August, so before the vaccination program was unleashed. And if we look here, our population, again, of 50 patients, were very young. Their average age was 35.5. So this was a young population with very little comorbidity. So a young, healthy population. We even had 8 patients who were pregnant as well. And we know that pregnant women have a much higher chance of having severe H1N1. So then when we followed these 50 patients when they were admitted to the ICU, we found that 66.7%, fully 2/3 of this 50-patient population, had renal injury by a formal criteria called rifle, had renal failure by the same criteria called rifle, which is more severe renal injury, and 22% went on to need dialysis therapy. Out of those total population of 50 people, 8 or 16% went on to die. So this was severe renal injury and severe H1N1 infection. When we looked at characteristics that were associated with renal failure and renal injury, we found that if we look here, the people who had severe renal injury often had a high BMI, and this higher BMI was also correlated in other studies with having more severe H1N1 infection. The reason for this is not clear. Asthmatics, or people with underlying lung disease, also had more severe renal injury. And furthermore, people with renal injury and the need for dialysis had an increased length of stay in the ICU. This is important because, first off, renal injury occurred at much higher rates than would be expected for a young, healthy population being admitted to the intensive care unit. It makes you wonder, or I could speculate, that H1N1 for some reason causes much more severe inflammatory response with subsequent kidney injury. And also, these people who went on to have kidney injury and need dialysis required much longer lengths of stay in the ICU. This has huge impacts on resources. If future pandemics occur, people get renal injury at a high rate, they may take up ICU beds and valuable resources.